My names are Dr. Catherine Nyongesa and I'm an oncologist, that is a cancer specialist, and I practice at the Texas Cancer Center. This facility was started back then in 2010 when we realized there was a gap or there was a barrier to patients accessing cancer care in a timely manner, and it was just a step forward to try and bridge the gap, and I know there are many other players who we work or we together so that we support the Kenyan cancer patient. So the unit has been in existence for now almost 12 years. We offer radiotherapy, chemotherapy, we have inpatient and outpatient cancer care. There's a pharmacy, CT scan, ultrasound, and just to mention a few of the services we have. The unit has been growing slowly with support really from the banks. They give us loans to run the facility, and we are two directors, myself and my husband, Mr. Dr. Samson Wanambisi Wata. So it's been a challenge, but we thank God the far He has brought us. We're just grateful in supporting cancer patients.
Daktari, tomorrow is World Cancer Day, themed Close the Gap. Maybe what's the significance of tomorrow's event to this organization?
So really it speaks to us. And also that theme of closing the care gap speaks to everyone. Whether you are a cancer patient, you are a common mwananchi, you are any individual actually in the world, this theme speaks to them and to us. It shows that in one way, as an individual, you should help relieve some of the obstacles cancer patients face, and there are a number of them. I'll just mention a few, like educational barrier, financial barrier to access of care. Sometimes even just having a facility you can access care is a problem, and also I would say discrimination against cancer patients. So all those things, the goodness is that these barriers are not cast in stone, and something can be done about it, and that is why we are all here collectively trying to see how can you help this cancer patient navigate these obstacles. For example, even just holding a hand and taking a patient to the hospital, or paying for them an NHIF card so that it can take care of their bills. Even dropping a cancer patient to hospital using your vehicle. If you have a taxi business, you can say this week in commemoration of World Cancer Day, we'll be ferrying patients to and from hospitals to their home, for instance. And in terms of creating awareness that people should be aware about cancer, the common symptoms, so that they can take action and not wait until it's too late. So I would say, to me, that is the significance.
Thank you, Daktari. Being a woman, you are young still when starting the organization. What moved you to come up with such a facility?
So one of the motivation really is just the pain and suffering of cancer patients. As a young oncologist, I saw what our patients were going through, and I said I should make a difference in their life just by starting something that will help cancer patients. Secondly, I've had, my younger sister had cancer, and as a medical student, I used to go with her to hospital. She goes to get her chemotherapy, and that was a wake-up call to me, because there were very few oncologists. I said, maybe this is a field I could endeavor. And I consulted around, and I was told, okay, it's fine, you can actually go for the oncology. My husband also, he has supported me to start this facility because his dad was a cancer patient. He had prostate cancer, and he unfortunately succumbed to prostate cancer. His sister-in-law also succumbed to cervical cancer. So all those things really speak to us, and we felt it would be important to have such a facility to offer timely cancer care to cancer patients so they are not waiting for too long. Yeah.
You have had an experience with many cancer patients. Maybe what's the most common type of cancer among Kenyans?
So in Kenya we see over 47,000 new cancer cases, and unfortunately close to 30,000 succumb to the disease. So we are looking at breast cancer, which is very common in women, followed by cervical cancer in women. And when we look at the men, the leading cancer is prostate cancer, followed by throat cancer, among them esophageal cancer. Then in addition, cutting across, we do get colorectal cancer. These are cancers affecting the lower part of the digestive system. And in children, we see mainly leukemias, brain tumors, kidney tumors, and eye cancers. Yeah.
In addition to that, Daktari, the hospital offers screening and therapy. Maybe can you explain how it happens?
Screening.
Yeah.
Yeah. So any person can walk in to be screened for cancer. We follow what we call the National Cancer Screening Guidelines, where there are certain types of cancer you can easily screen for. For example, we screen for cervical cancer, breast cancer, even prostate cancer, depending on the age of the patient. And also we give awareness about the common signs and symptoms of cancer so that one can be on the lookout. So when you come to hospital for cancer screening, it is not just being tested, it's about being given more knowledge, getting to know about your body. If there's something worrying you, the doctor will try to explain to you. And many a times it's really a talk to the doctor and examination, and if the doctor finds there's nothing, then you don't even need any more testing. But if the doctor suspects that there's something, then it will be good for them to test you. Yeah.
What are some of the major challenges in experiences, especially in running the organization?
One is the patients come in late stage, many of them, and that is a challenge because as much as you're trying to help, but you find many of them may succumb to the disease just because of the late presentation. We also face financial challenges when patients come and they cannot afford care. They may want to be waived or supported, and unfortunately we don't even have people to support us, like funding to give free treatment to patients. So we have a challenge there. Another one is that we take out loans and you have to repay the loans. The cancer medicines are expensive, so it's also an expense to the patient. Another challenge really is just that running such a facility itself is expensive, and you really have to put in a lot of time and any savings you can get, loans to keep it running. So I would say those are some of the challenges we faced.
Dr. Nyongesa, maybe you tell us what is stage of the cancer that is most dangerous to the patient?
So cancer is curable if it's diagnosed early. Stage 1 and 2, the chance of cure are higher. When it goes to late stage, which means stage 3 and 4, the chances of cure are reduced. Unfortunately, many patients come in late stage because either they are not aware that they have cancer, or they get misdiagnosed. By the time they really know it's cancer, it is a bit too late. And others, they present to hospital early, but because cancer is a big mimicker, it mimics so many diseases, so they get treated for other ailments, and by the time they discover it's cancer, it's a bit too late. But I can report that we've actually seen cancer patients who have gotten help and gotten cured, and we thank God for that.
So how many patients do you receive by a day?
So in a day we see about maybe 100 patients, but it depends, because some of them they actually coming for radiotherapy. We have some coming for chemotherapy, and others are on regular routine follow-up or new patients. So it's a mixed population. Cancer treatment is a journey. Like a patient may have to be coming to hospital repeatedly for a month or 6 months. So you may find one patient comes today, tomorrow, like that. So the numbers are higher, but actually the real number of patients you find, because of just repeated visits, they seem to be like I would say the same patient may come today, tomorrow, and the next day. But cancer it's a major public healthcare problem.
Natalie, you've spoken of funding and finances is a challenge. Maybe is the government participating in helping maybe to finance the organization of patients for treatment?
I would say the government plays a big role, especially in NHIF, supporting the cancer patients. So this has relieved the financial burden from patients, but it's not comprehensive. So still up to a certain level, it's not able to support them. But we do appreciate that the step the government took in terms of providing this kind of service. The other way I get government support is, I think, is just being given the opportunity to practice. I'm also a government, like I was trained or educated by government, like I got a scholarship from the help loan. So I'm really grateful. I went to public schools, a public university. So I would say the government has played a big role in my journey for me to be where I am. For you to run such a facility, you need to be licensed, and you get licenses from the government. So you have to pay a fee for them to, like a licensing fee, for them to license you to practice. So I would say in that aspect I've gotten support from the government, but I would appreciate if there's anything else they can offer, like some finances, soft loans, because it's a major struggle to run such a facility.
Maybe out here, what would you like to tell people who are not aware of cancer, who don't know even how to handle cancer patients?
So cancer is not a death sentence. There's always hope, and I would say this month, February, being the February the 4th is World Cancer Awareness Day. I would say that people should come together in a small way to support cancer patients, and they should also be on the lookout if they have some symptoms or some diseases and they don't see they are getting well despite repeated visits to the hospital, that they need to be screened for cancer.
Thank you, Dr.
Thank you.
Maybe they tell you your parting message to the patient, to the family that have cancer patient.
So when you have cancer, it doesn't mean it's the end of the world, that there's always hope. And I would say my favorite message is that everything heals. You have a wound, you have a cancer, you have pain, it will heal in God's, when you believe in God and God can support you, and you can heal. And if you have a cancer which is in the late stage, there's hope in that the treatment can help relieve some of the distressing symptoms. And if you have early cancer in early stages, there is a very high hope of cure. Thank you.